Hello, everyone. How are you today? Thanks for joining us. We're actually waiting for our special guest. Let's see. Mm, so we're just waiting for Dee to join, and then we can go ahead and get started. Hi, Adam. Hi, Grayson. Thanks for joining us today. Hello. Happy Thursday. um, okay, let's see. Let's see. Thanks for joining us. Let's see. We're having some trouble um, with our guest joining our live. So let's see if I can get her on. Let's see. Okay. Hello.
Hi. Are you
I'm
doing?
so sorry about the account not working.
Oh, it's we're here now. It's all.
Yes.
I'm just not very agile with this one. I mean, I use it pretty much for this, so the never
Okay.
where the connection is going to be right.
Okay. Awesome. Well, thanks for joining us today.
Yeah.
Um, are you all set and ready to start?
Whenever you are. This is
Okay.
one of the things I love to talk about, so I'm happy to do that.
Okay. Sounds good. Well, my name is Ibukun and I am an AmeriCorps Fellow here at the Community Health Team. And today we're actually going to be talking about something that is very important. So October is Breast Cancer Awareness Month. And we felt like it was important to talk about breast cancer and its relation with the queer community, specifically Black queer women. So today I have Dee here with us, and she's very well versed about the topic, and she's going to give us great information, and we're going to learn about, just breast cancer and how it affects Black queer women specifically. So Dee, if you'd like to do an introduction, that would be great.
Okay. Hello, all. Dee McGreeny here, Whitman-Walker Health. Pronouns she, her, and hers. And let's see. I think that's what I'll share today. I'm happy to talk about, and I'm going to reframe just a bit. So I'll be talking about breast health as it relates to the community. I like to start from a place of we're all sitting someplace not fearful, and then let's look at how to maintain that.
Yeah, yeah, that's great. So I guess my first question for you is, what are we raising awareness for this month, and why is it important? Why
Uh,
are we talking about this? Why should we care?
why should we care? Well, traditionally, October is looked at as Breast Cancer Awareness Month. Uh, Frankly, I think that terminology, although it does kind of illuminate the problem of around breast health and maintaining that, it also shuts out some people from the conversation that really need to be involved in the conversation. So the idea of when we think of breast cancer, again, I go back to thinking about health, the health of the body, and then the different ways that folks are affected. So yes, breasts are affected, but chests are also affected. Folks that walk around with that idea of their body and that perception of their body should be honored and need to check the area as well. So it's not that one whole segment of the population is eliminated from risk. We all need to be looking and being aware of what October sort of represents is one, a screening kind of situation. What do we do to know that our body is healthy? Who do we go to if we need to engage somebody else? And what
Mhm.
should it look like? I think those are the things that October's pointing at.
Yeah, thanks for sharing that. So how does breast, I know you said we should use like, rather than just saying just like breast cancer, we can also say like chest cancer. So how does breast and chest cancer impact the Black queer community? Do you have any about that?
I'm not going to bring stats with us, but what I will tell you is this, that all the ways that we've kind of looked at how cancer forms in bodies, it can be around environmental factors, it can be around mm, our bodies, the knocks that our body has taken already in terms of um, diet, exercise, heredity, all those factors coming into play. Smoking is part of what goes on. That all those are a risk. Now, when you take that and look at how race, ethnicity, and sexual orientation kind of impact those things, access to care is one of those too, then that can elevate risk. So, one, I don't want people walking away thinking that because of their orientation or their gender identity, that somehow that's going to put you more at risk for cancer in general and breast cancer specifically, but it could up the ante on the things that affect health in general and breast cancer specifically. And one of the ways I would look at for us is or for folks that identify as LGBTQIA, is the stressors involved in life in general, the lack of direct education towards the community. So if you don't say my name, are you talking to me around this? And access to safe and culturally competent screening. Who are we going to see if we need to engage somebody else in our care? How do we know that's safe?
Mhm. Yeah, those are all really, really good and important things for us to keep in mind when we're talking about why is there like what is affecting the access to care, or like why are people getting screened at later times versus certain communities. Just knowing there's just so many like compounding like factors affecting
Yeah.
Black queer women, it's important for us to just keep that in mind. So knowing this, what ways can we raise awareness for breast or chest cancer month, especially as it affects the Black queer community?
Well, I think it's a gathering of information that exists.
Mhm.
Sometimes it's translating that information into language we can use. So again, a binary sort of idea around who is needing to look at that area of the body is really, I think, set that aside. And some of it is about holding on and amplifying the messages that actually work, that
Mhm.
mean something. So no, the community is not monolith. So some of the messaging that has traditionally gone through the route of delivered through church ministries, delivered through barbershops, delivered through hair salons, that should stay. If that's been a workable situation, don't remove things in order to create something else, but amplify, magnify, and truly listen to the messages that come your way that are for you. Often we hear, and that's part of my pushback on cancer, we hear cancer and people slam down. I really want to engage people around how to maintain health.
Yeah.
That is an invitation versus a oh, now I'm frightened kind of situation. So I hear it. I understand that scientifically, technically, that's what we're talking about, and I'm not trying to minimize it. But how do we get on the side of what might actually be a message that can be taken up by someone else?
So what kinds of screenings are available for individuals to assess their risk, and to also just maintain their breast health? And how does that translate specifically to Black queer women or Black queer individuals and their access to these types of screening?
Well, yeah. Um, screening's a pretty particular thing, but there's some landmarks that I think would play out. But in terms of assessing our risk, because we are not wholly sure on all the elements that go into causing breast cancer to happen, it's hard to assess fully risks. So there could be elements of age, there could be elements of geography, there could be all these different things. We know smoking, we know there are some chemicals that are more likely to drive one way. There's elements of food that we need to avoid. We need to avoid more weight than we need to carry, which does not mean shaming body. It means figuring out how much fat your body can handle and what's a healthy weight for you. That's all I'm saying, because it really, that weight thing can tumble into some really unhealthy behaviors. So really looking at, again, coming back to the line of what would keep a Black person healthy. How do we maintain this Black body is where I'm going. So food, water, sleep, all all the good stuff. And then being mindful about what is normal for you in this body. You know what I'm saying?
Yeah.
So we look, we spend a lot of time looking at our face every day. Check. But my invitation here is for us to look lower.
Yeah.
Really put that level of attention from neck to waist and the rest of the body. But look at your skin. Look at the texture of your skin. Look at any dimpling, puckering, any changes that are going on. Because I can run the list for you of what those changes might look like, but you're living in here. You're living in here. So the same attention you pay up here, please pay down here. But I did mention dimpling, puckering, if your nipples change direction, if you start to have a discharge and you've never had it, that's something to be aware of and go see somebody about. Swelling under your arms, swelling in your neck. It could be one thing, but it also could be a problem, so check that. And then the immediate after your visual is your hands. Touch the body. Not a seek and destroy mission, I'm looking for lumps, but see the natural contours of your body without judgment.
Hmm.
What has been there? What's different?
Yeah.
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 And then enlist someone else. Once we have a good understanding of the topography, then you can go or engage your primary care physician in a conversation that's informed. This is where I felt this. This is what is this you're feeling over here? Get, give and get information in that situation.
Yeah.
Yeah.
One follow-up question to that I do have is, do you have any suggestions for how to bring up these conversations with a physician? Because I think that could also be a barrier to um, receive care, is just not knowing how to bring this up, or just feeling like you might not be believed or not taking it seriously, or so like, do you have any suggestions of what people can do when eliciting these like conversations with their physicians or whoever their healthcare provider is?
I certainly do. I certainly do. One, I would say I know that it is not technically what we as consumers are trained to do is to question the
Mhm.
power dynamic within that room. But it's your time, you're paying for it, it's your body. So one of the things that I learned to do early on was make a crib note. I mean, I think okay in the little paper gown, but I don't think great in the paper gown. If I have something to help prompt me back, even if I've written it, but I don't have the note with me, the
Mhm.
the idea of scribing it, of writing it down, kind of brings it to your mind. Short list. I want to, can we go over my breast self-exam technique? Okay, good question, and that should really take them 4 or 5 minutes. And not that's not a detailed thing. What should my next screening steps be? So they know your age, and if you need, so they should be doing a clinical exam when you come in. If you're in the age range for mammography, if you're family history points at it, if there's something within your breast that points at it, if it's just time in terms of age and the recommendation, then ask those questions, because honestly, if you don't, often the doc is moving on to something else.
Yeah.
You have to kind of generate those referrals, that question yourself. Yeah.
Thank you for sharing that. I think that that's really important. Like just keeping track of, I think, yeah, it's whenever I go to the physician myself, like I always, like I'm not able to, like you said, kind of like think it straight, because there's an obvious power dynamic at play, and you often feel like asking a question is like doing too much, or like, but you're right, you're paying for it, and like that's their job, is to you know um help you, and if it's a good physician, they'll like be able to listen. But yeah, writing down like a like a little cheat sheet or something of everything you want to ask will help you feel more secure in yourself. um, so I don't have any other questions for you. Is there anything else you wanted to share? This is really informative. I learned a lot, and I can't wait for people to like actually go back and watch this. Is there anything else you wanted to share today?
I think if I could leave folks with one thing is, well, it's a couple things. To
Okay.
know, most female body persons interact with medical providers around birth control if needed. If you're not needing birth control, it might be less likely that you see a physician, which would make this conversation a non-starter. You wouldn't be seeing anybody. Please, 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 regardless, while it's not a stressor, find a primary care doc. We're sitting in a perfect place for that. Find a primary care doc that is culturally competent. We're also sitting in a good place for that. Find that person and then begin your journey with conversation. What are the goals and objectives I have for this relationship? If you're not entering ill, then you have time to plan where you want to go. Not focused on pathology, but focused on health. That would be the thing for me. Yeah.
Thank you for sharing that. That's great. Like, I think that's great advice, and I hope whoever is watching this or watches this in the future keeps that in mind. But I just want to say thank you so much for joining us today. I really appreciate this, and I learned so much. Like literally, I'm gonna go think about this stuff for myself, and I also have family members as well that I think would benefit from this information. So thank you so much again, and for the people watching. I just have to say a few things before we end off our live in regards to the COVID-19 pandemic and the vaccines. If you haven't already been if you have been vaccinated, we want to say congrats and thank you for taking this step to preventing yourself, your loved ones, and the people around you from illness. We know that there's multiple variants still going around the US, and it's completely understandable if you want to continue wearing your mask, social distancing, or any of the other CDC recommended guidelines. And if you haven't been vaccinated and you are looking for an appointment, we do want to let you know that Whitman-Walker does offer the vaccine for everyone ages 12 and up. So you can call us at 202-207-2480 to make an appointment. And if you are having problems reaching out to us and you live in the DC area, you can call 1-855-363-0333. If you live in Maryland, you can call 240-777-0311. And if you live in Virginia, you can call 877-829-4682. And if you haven't been vaccinated and you're not looking for an appointment, we do urge you to still continue following the CDC guidelines. So continue wearing your mask, continue social distancing, continue quarantining when necessary, because you don't really know when the people around you are vaccinated or not, and you just want to continue staying safe despite getting the vaccine. And finally, next week we're having our annual Walk to End HIV, and this year is really important. It's the 35th anniversary. So the walk is taking place virtually on October 23rd on Saturday. So you can register at walktoendhiv.org. And please follow us on Instagram, Facebook, Twitter, TikTok. You can find our go on our website to get any information about us. And you can always call us at 202-797-4439 to make any appointments or to learn anything about the resources we offer here at Whitman-Walker. So thank you once again, Dee. It was so nice talking to you. Hope you
Yeah,
have a wonderful rest of your day. And I'll
take
talk to you later. Bye.